everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very important topic, that is providing safe and clean physical environment. So here, as we all know that in a hospital setting, whenever we are providing care to any client, it is very important that we must provide an environment in which they feel safe, they feel secure, they feel comfortable, as well as an environment which is clean, right? So in today's session, I'm going to teach you about what is the importance of providing a clean and a safety environment for the client. So what do we mean by safety? Here, safety is defined as a freedom from any psychological as well as physical injury, any health care which is provided in a safe manner as well as in a safe environment is very essential for the patient's survival as well as for their well-being. So why is this safety important? This safety is important because it helps to reduce the risk of illness and any injury. It also helps to contain the cost of the healthcare, and not only that, but it is also through the safety that it also helps to improve as well as to maintain the patient functional status. And the last importance is that it increases the sense of well-being. So I hope you have got a clear understanding of what do we mean by safety, right? So why is it important that we must provide a safe environment for the client? Here, as we know that environment includes the setting in which there will be an interaction between the nurse and the client, and the settings can either be the hospital, it can be the clinic, the community health center, the schools, the long-term healthcare facility, as well as it can be done at home. So a safe environment is an environment which will help client to meet their basic needs. It will also help to reduce the physical hazards and also the transmission of the pathogens as well as of the microorganisms from one person to the other, as well as it will also be an environment which will have a great control on the pollution. So here, as I've said, right, that safety is defined as a freedom from any psychological as well as physical injuries. So here, a safe environment is an environment which will reduce the chances of the client to encounter any physical hazards. The psychological needs here also include the oxygenation, the optimum temperature, as well as the nutrition. So here, as we know that in order to gain a good health, it is important not only that we prevent ourselves from any physical hazards, but it is also important that we are emotionally as well as psychologically fit, right? So here, whenever we provide care to the client, it is very important that we create an environment in which they can feel safe, they can feel at ease as well as comfortable. So what are the various items, what are the various equipments that must be present in order for us to be able to provide a safe environment for the client? So talking about the environmental safety, let us first discuss about the oxygen. So here, as we know that supplemental oxygen is sometimes required in order to meet the oxygen requirement. So a medical oxygen will always be stored in the healthcare setting. And also, as we know that smoking is the leading cause of fire, of burns, of injuries, and even death. So sometimes it can also be caused because of this medical oxygen use. That is why in order to be able to create a safe and a good environment for the client, we must make sure that this must always be checked. And then the second one is the nutrition. Here, the healthcare facilities are required to meet the State Board of Health regulations such as the Food Safety and the Standard Authority of India. So here, any food that is inadequately prepared or any food that has been stored in an unsanitary condition increases the patient risk to suffer from food poisoning or even from infections, right? So here it is very important that in order for us to be able to help the client, in order for us to be able to help them promote their health. It is very important that we must make sure that whatever food is being provided to the client, it must be adequately prepared and it must be stored in a good condition in order to prevent them from suffering from food poisoning or any other infection. And the third one is the temperature. So as we all know that temperature can also affect the safety and the comfort of the client, right? Why? Because here if the temperature is too low, then it can also lead one to suffer from frostbite or even from hypothermia. Whereas if the temperature is too high, then it can also lead one to suffer from heat stroke or even heat exhaustion. That is why it is always preferable that a temperature of at least 68 to 72 degree Fahrenheit or 20 to 22 degrees Celsius must be maintained. And the next one is humidity. So what do we mean by humidity? Humidity is the moisture which will be present in the air, right? So here humidity of between 40 to 60% is considered comfortable, whereas if it is lower than 40% or if it is higher than 60%, then it can also make the client feel uncomfortable. And also to help the client feel more safe, more comfortable, and even fresh, it is important that we provide a proper ventilation. If we provide a proper ventilation, then there will be a movement of air inside the room, right? And this proper ventilation can be provided by opening the doors and windows which is present in that particular room which the client is in, or even through the use of fans or air conditioners. And the next one is noise. So as we know that noise can sometimes produce irritability, restlessness, fatigue, and even exhaustion in clients who may suffer from acute or even from chronic illnesses. Therefore, care must be taken that noise must be avoided. So here any noise which is caused by friction can be reduced by lubrication, as well as we can use other methods such as usage of rubber tires for wheelchair, usage of soundproof room. We should also avoid dropping of any object, and whenever we are talking, we should make sure that we do not talk loudly. And if there's a television or a radio nearby, then you should also make sure that the volume is low. So here it is very important, especially in a hospital setting, that you should avoid producing any sound, because the client may get irritated, it may disturb their sleep, and even it may lead them to become agitated. And the next one is the physical hazard. So here, and can also lead them to be agitated. So the next one is the physical hazard. So these physical hazards includes the motor vehicle accident, the cases of falls, of burns, and even of poisoning, right? So here, whenever you are creating an environment for the client, you should make sure that you create one in which it will enhance the safe and comfort of the client and reduce these physical hazards from occurring. So these are the various things that you must keep in mind in order for you to be able to provide a safe as well as a good environment for the client. Now moving on to the next, that is factors influencing the patient safety. The first one is the age and development. So here, older patients are at a high risk of experiencing a patient safety event. Studies that has been conducted in the inpatient setting have assessed that the effect of age in the rate of the safety events have consistently concluded that older patients experience more adverse events than younger patients. So here in simple words, I can say that studies have proven that usually older patients are at high risk of encountering physical hazards as compared to the younger ones. And the next one is the lifestyle. So here the lifestyle also plays a major role in influencing the patient safety. Why? Because here the beliefs that you have, the way that you live, the food that you eat, the exercise that you perform also plays a major role in influencing your own safety. The third is the impaired mobility. The fourth one is the sensory or the communication impairment. The fifth one is lack of safety awareness. That is why it is very important that we as nurses must always educate the client about the do's and don'ts so that they become aware and they will be able to take care of themselves and also prevent themselves from any hazards. The sixth is the emotional state, and the last one is the environmental factors. So these are the various factors that can influence the patient's safety. So we have come to the end of this topic. So in today's session, we have discussed about the importance of providing a clean and a safe environment for the client. We have discussed about what safety is, what environmental safety is, as well as what are the various factors that we need to look into and we need to maintain in order to be able to provide a good as well as a safe environment for the client. And at the end, we've also discussed about what are the various factors that can influence the patient safety. So I hope you guys have got a clear insight of this topic. I'll be meeting you guys in another session. Until then, have a good day. Thank you.